All right, so thank you for the tallies here and abroad. Now for a closer look at the situations on the local front and beyond, Yeon-seung joins me in the studio. Yeon-seung, welcome back.
Glad to be here, Sunny.
Right, first, and I hear COVID-19 transmissions among the young here in the country is on the rise.
Yes, exactly. So COVID infections have been rising among young teenagers and adolescents. So of the some 2,700 infections in the city of Seoul, teens and young children accounted for 1 in 5 cases. It's especially concerning when young unvaccinated children become infected, and they make up around 10% of the capital city's cases. Wednesday saw another cluster infection being reported at a daycare center in Yeouido, Seoul. 16 young children and 3 adults were infected in that outbreak.
I see. On the treatment front, Yeon-seung, health authorities, I understand, are seeking to make most of their current capacity by calling for a limit, is it, on the time spent in ICU by COVID-19 patients. Could you tell us more?
Yes, exactly. So the measure you mentioned is actually quite a stern step that the health authorities are taking to really improve the turnover rates of the ICU beds. They're asking people who spent more than 20 days in treatment to leave the ICU so that the beds can go to the people who need them the most. In fact, authorities for the first time have ordered 210 patients who had been in the ICU for more than 20 days to transfer to another hospital or a different bed. And if they refuse to vacate, they'll be fined in accordance to Korea's Infectious Disease Control and Prevention Act.
Right, Yeon-seung, let's now shift our focus to the Omicron variant. What is the latest on that front?
Well, 12 new Omicron cases have been detected in the country, with 4 being domestic transmissions. The total Omicron infections reported in the country now stands at 246. But one of the biggest problems that health authorities are facing in their battle against Omicron is their late response. The current PCR tests in Korea aren't really able to pinpoint the Omicron strain among other infections. So instead, scientists have to use genome sequencing as a method to detect Omicron. But this process takes 4 to 5 days, making it extra difficult for authorities to curb the spread of the virus in the meantime, especially as they're dealing with a highly transmissible strain. Central Disease Control Headquarters said Wednesday that they're currently developing a COVID-19 variant test kit that will quickly identify all 5 variants of concern, including Omicron. The new PCR test authorities are currently developing will give results in a day, providing more ammo for health officials who are preparing to respond to virus outbreaks as quickly as possible. Authorities aim to put these tests into use by the end of this year.
Right. Meanwhile, Yeon-seung, beyond our national borders, how are Korea's counterparts faring against Omicron?
Well, unfortunately, the UK saw another record high in infection cases. Their daily tally soared above 100,000 for the first time. And France may not be too far from seeing a similar situation. The French health minister projected that their daily cases may jump from 70,000 to 100,000 in the near future. He also said that Omicron may become the dominant strain as early as next week, as it already accounts for about 1/5 of the new infections in its most populated capital city, Paris.
So, Yeon-seung, what has been the response to the threat then posed by Omicron by authorities elsewhere?
Well, the answer may be in the 4th shot. So, Israeli health experts earlier recommended a 4th COVID-19 jab to boost the immune response. The German health minister also mentioned recently the need for a 4th COVID-19 vaccination shot, as the country's health experts said that it may take around 3 weeks for Omicron to take over as the dominant strain.
Now, Yeon-seung, earlier on Wednesday, we were joined by a physician in South Africa who was the first to warn the world about the presence of Omicron. What more has been shared about this new variant and its impact on South Africa's fight against the pandemic?
Well, there may be a rosier outlook suggested by experts. Day after day of seeing Omicron backsurges and infections, cases in South Africa seem to have simmered down in recent days. And experts say that South Africa may have gotten past its biggest hump. After hitting a record of around 27,000 daily cases, the tally dropped to the 15,000s early this week, and the downward trend seems to be continuing. Although it's too early to draw any definite conclusions, and despite the fact that the daily tally is not an accurate measure of virus behavior, in light of the recent trends, scientists say that Omicron infections may come in a short wave. And the good news is that Omicron hasn't brought severe spikes in hospitalizations and deaths. Take a listen to an expert's take on why she thinks Omicron has been quick to recede.
It's that we had a lot of infections, so people really start creating immunity in the community, and so there are not that many susceptible individuals that will be infected. So it's epidemiologically it makes sense.
Right, and hopefully that reality continues to translate into fewer cases in South Africa in the near future. All right, Yeon-seung, thank you. See you on Friday.